This is just a test to see how the whole setup looks from my point of view. I'm doing a catch up since 2009, as you can see there. The reason why I haven't been talking about Shak Stroke Therapy for such a long time is that I've been involved in so many different projects, but I've always helped people who've had a stroke or a head trauma, and I've never charged for it, ever. But there's a lot of people want to know how to do it, and Shak Stroke Therapy is something that I invented for my own father. I've been a clinical therapist, hypnotherapist, since 1974. I take my glasses off because it's reflecting all over the place. But I've been a clinical hypnotherapist since 1974, and my father had a massive stroke in 1986 when he was 49. Last year, he sadly passed away, aged 87. He had a fantastic innings, and he is the best dad ever. I say is because I know he's watching over us, the whole family. Is brilliant. But he had a stroke and it affected his complete left side. And what happened was he had to go to therapy. So I took him to physiotherapy on a few occasions and I was bending his arms backwards and forwards. And I was watching. And after a little while, I got to know the physiotherapist and I asked her, what the objects of bending and stretching the arms are. She said, gradually, the signal will eventually go back up the limb and reattach itself to the brain. So I said, well, we're talking cognitive. So how long would that take of using your process? And she said, about 2 years. I'm like, 2 years? That's a long time. I said, well, why can't you just do it from the brain? And she just looked at me as if I was stupid. And she said, no, that's impossible. Now, as a man who deals with the brain since 1974, it's now 1986 when my father had this stroke. I've been doing it quite a lot of years. I thought outside the box and I developed a method that helped my father to such an extent that he was back at work in 12 weeks, fully recovered. The technique for a lot of years was called John Green can help you. Now, my father, when he got back to work, he said, why restrict this to me? There's a lot of people out there who he met that could use this type of therapy that I designed for my father. So what I did, I got literally, not exaggerating, thousands of volunteers over the years since 1986, and it's now 2024. Every single person that I help is an experiment, and I've perfected it to the point there I can pass this on to other people who have no skills in hypnotherapy or in the mind. You can just use the process that I have designed and you can implement those on your loved ones, or even if you're a clinical therapist, put them as another tool in your toolbox to help stroke survivors or head trauma survivors. I've seen people recover within minutes who have been what you would call disabled for years due to the effect of whatever the head trauma was, be it a stroke or a bang or whatever. And I've walked into some people I have thought, no way, absolutely no way this is going to work. And before I leave, they're back to normal, or they have improved to such an extent that they and the family have noticed a massive improvement. It gets people in tears. Yeah, they look at you as if you're some form of faith healer, and you're not. You just know how to use the mind and how to implement it so you'll start to redirect those neural pathways to go to different ways as opposed to trying to get through the blockage where the damage was within inside the brain. It's caused a block. So why not use something to go around the block and just continue as if nothing was ever damaged? I've seen people's limbs suddenly start to move where there was all spasmed and they couldn't do anything. Now they're absolutely fine. They're living a normal life. I have quite a lot of videos on YouTube, the before and after. With their permission, I've been allowed to use these videos. The reason why I stopped putting these sorts of things on was because I was getting bombarded with negative people saying they're actors, it's not real, this is too far-fetched, this can't be, it's impossible, who do you think you are, Jesus, these sort of things. And it really affected me mentally, and I thought, no, I'm pulling away. But now, a lot of years later, I'm now 65 years of age, and now I can take anything that some negative keyboard warriors want to throw at me, because there's people out there what do need this therapy, that do need the help, and I am here to pass that on so that you can get the help. I have people literally fly from all around the world and come and meet me at a particular hotel in Hull where I live, and I've done a few videos of these people. They're wheelchaired into the hotel, and once I've done the Shak therapy, I take them for a walk around my hometown, and they're limping and stuff because they've been immobilized for many, many years, some of these people, so they've got wasted muscle tissue, so they need to build up these muscles. I have physiotherapists now who trust me, and they initially they thought I was going to take all their jobs away, they'd never be needed. They couldn't be further from the truth. Physiotherapists do as much as they possibly can, but if the patient they've got gets despondent, they've had enough, they feel it's not working, they'll pull away. So now what I do is I can go ahead of the physiotherapist and do a Shak therapy. It's free. I've never charged anyone a penny. These are other comments that I get. Con man, it's just after your money. I've never charged a penny for it. I have written a book on Shak Stroke Therapy, how to do it. I've made a DVD which is downloadable. You can get a hold of that as well. I do charge for those. This is the reason why I don't charge the people that I help. I just charge for my coursework. That's all I charge for. The people I help, it's totally free. I can't thank them enough for allowing me to be able to show you the before and the after. Now, there are a lot of people, in fact, more people that don't want to be on video because they're not that way inclined. There's more people that don't want to be in video that I've actually videoed, but they're behind the scenes, and I'm just pleased that I can help them. They do give me testimonials, which is nice, but Shak Stroke Therapy, I would like to now start making more videos and explain a bit more about it and answer questions if I can possibly answer the questions. So on that note, I'll leave this recording now, which is just a test really. I'll leave it just to see how it comes across to me. If it looks good, I'll start using this platform.